It's 10 o'clock and it's about time to start our sharp final conference. Good morning, everybody. Happy to see you all here. We've been working together for more than 4 years, and it's about the time to wrap up our good work in Sharp Joint Action. We have 2 days program today for our final conference, and there are more than 100 participants here on site and more than 70, to my understanding, online for these 2 days. And I see very many familiar faces here in the audience, very many with close collaboration, but there are also some new faces. So first of all, my name is Anna Katz. I work here at THL, the Finnish Institute for Health and Welfare, currently as head of the unit for infectious disease control and vaccinations. And now I've forgot, I should be actually here, of course, in the more formal position with the flowers. So I've been working now more than 4 years as Sharp project manager. We started our actions in 2018 to plan the joint action, and we really got it started 2019. And now it's time to finalize and really tell you all what we've been doing. So during these 2 days, you will hear what we have achieved during these 4 years. A few practical information before we start and before I give opening words for Otto Helve, who's the head of the Department for Health Security here at THL. First of all, we have, by the entrance, we have toilets. There are also lockers if you need to leave something. I don't know how much space there is, but nevertheless, you can try. And we are having plenty of coffee breaks today. We wanted to have free time to talk, since we've been mostly seeing each other via Teams or Zoom or whatever, WebEx, during these last years. So I'm really hoping that we can have fruitful discussions during the coffee breaks as well. Then we are having dinner tonight at 7 o'clock for those who have registered. And, well, let's talk more later on. But with these words, I will now give floor to Otto Helve, and before you come, I'd like to introduce you properly. I do remember who you are, but still I need the notes. So, Chief Physician Otto Helve is a PhD, and he's the director of the Department of Health Security here at THL since last fall, October 2020. And in this post, he's leading our department, which has wide responsibilities for national level infectious disease surveillance, preparedness, prevention and control, and environmental health protection. Otto has worked at THL continuously since April 2020, and he was here in several positions also before that. Before his current post, he was leading the unit, which I'm heading at the moment. And Otto is member of several boards, committees, and associations, namely the Advisory Board on Communicable Diseases, the National Advisory Committee on Vaccines, the Finnish Association of Science Editors and Journalists, and Association for Medical Education in Finland. And his background is he's pediatrician and pediatric infectious diseases specialist and public health specialist. So with these words, please, Otto, welcome.
Right, thank you very much. Okay, dear colleagues, dear friends, it's nice to see all of you here this morning. And on the behalf of the Finnish Institute for Health and Welfare, I welcome you all to sunny Helsinki for the final conference of the Joint Action for Strengthening International Health Regulations and Preparedness in the European Union. SHARP is an enormous undertaking and is formed by a large network of active participants. The partnering countries are, in addition to Finland, Austria, Bosnia and Herzegovina, Croatia, Czech Republic, Denmark, Estonia, France, Germany, Greece, Hungary, Ireland, Italy, Latvia, Lithuania, Malta, Moldova, the Netherlands, Norway, Poland, Portugal, Serbia, Slovenia, Spain, Sweden, and the United Kingdom. The associated partner countries are Belgium, Bulgaria, Iceland, and Switzerland. And I would like to thank all the participants for their joint efforts in SHARP. Now, the aims of SHARP are to strengthen preparedness in the European Union against cross-border threats to health and to support the implementation of the IHR. Considering these aims, the joint action started in 2019 has been right in the middle of the pandemic for its theme, but especially for the workload of its partners. Since all participating entities have been involved with the pandemic response in their own countries, this has posed challenges to the implementation of the joint action, but also made it possible to increase the impact of the work, since it has been directly linked to operational issues at the same time. And I cannot but be astonished when looking at the deliverables provided by SHARP during these extremely critical times, when we all have been overburdened with other issues of immediate concern. Health threats such as pandemics are rarely a crisis limited to a single segment of a society. And I think we've all learned this lesson to the core. It takes a village to prepare for health threats. The Finnish Institute for Health and Welfare, THL, is a research institute that combines a large number of fields of science on health and welfare, from surveillance of pathogens to studying the societal impacts of alcohol abuse, from forming contact matrices to studying different indicators of welfare, and from evaluating the impact of school closures as a pandemic response to studying the adverse effects that closing schools have on the well-being of children. During the pandemic, all these wide-ranging fields of science were required for us to balance the direct impact of the pandemic and the secondary effects of the mitigation measures used in order to contain the pandemic. I believe the work that we have done at THL underscores the importance in participating in enterprises such as SHARP, where an enormous amount of knowledge from partners from different fields of science is combined to create a synthesis aimed at finding solutions that might otherwise be hidden from view. I again emphasize the honor of working with you. Now, sustainability of the outcomes of SHARP is of course crucial, and it is noteworthy that in SHARP we aim to achieve sustainability at regional, national, European Union, and global levels. And this is what preparedness is about. This is possible only by working together. The agenda of the next 2 days includes discussions on improving capacities against health threats, hospital preparedness, cross-sectional cooperation in preparedness and in response, the IHR, and I expect the IMB process to be mentioned as well, laboratory preparedness, training, chemical threats, or lessons learned from the COVID-19 pandemic, and then discussions on the overall project, on the impacts and sustainability, just to name a few. And I'm very much looking forward to interesting discussions on these extremely important subjects. So once more, I'm honored to open this final conference on the joint action. I thank you for joining us here on site in Helsinki and online. And let's enjoy our time together and gain new insights into the themes that connect us in the world. Tervetuloa.
Thank you, Otto, for the opening. And on behalf, I wish to wish you all welcome to THL as well by my side. And I forgot to say before we started, so a few more household things. We have team here from THL. We have a big team organizing this, so you can also recognize them with the badge. So you may ask help from any of them if needed. And in addition, I forgot to advertise our app because we have, this will be streamed online and we have the application, so you may download it to your mobile or access it by computer. So you will find also some information from there and all the practical information, how to get to the restaurant in the evening and so forth. But let's continue with the program. And we had the words of welcome from Otto, and now we have opening words from DG Sante, and also a welcoming note from the director of ECDC, and we have also a representative from the Ministry of Social Affairs and Health Finland present here. And I will introduce now all the three speakers who will give their words for our joint action. And first we have online, we have Stefan Schreck from DG Sante, from the Commission. And he has been working since 1997 at the DG Sante on Public Health Directorate in Luxembourg, in particular in the areas of communicable diseases, health threats, and substances of human origin. In 2008, he became head of the health units in the Executive Agency for Health and Consumers. And in January 2011, he was appointed head of the Health Information Unit of DG Sanko, with responsibility for health information policy. Then he continued as head of the DG Sante's unit health program and chronic diseases, dealing with policies for all non-communicable diseases, planning and drafting annual work programs of the EU health program, and contributing to the implementation of the health cluster of the Horizon Europe. Since September 2020, Stefan Schreck has been an advisor for stakeholder relations excuse me, in the Public Health Directorate of DG Sante. Then the next speaker, we will have a pre-recorded video from Andrea Ammon, from the director of ECDC. She's a medical doctor, master of public health, and she was appointed as director of ECDC in June 2017. She has served as deputy to the director and head of unit for resource management and coordination earlier, and as acting director. Andrea Ammon joined ECDC as head of the surveillance unit already in 2005, and the unit was responsible for developing European surveillance system and implementing a long-term surveillance strategy for the EU. Prior joining to ECDC, Dr. Ammon served in several roles at the Robert Koch Institute in Germany, and most recently as head of Department for Infectious Disease Epidemiology. And in this capacity, she further developed the German national surveillance system. In many aspects, outbreak response team and coordinating emergency planning for influenza, directing the national field epidemiology training program, and also provided scientific advice for the government, ministries, members of parliament, and the public. And our last speaker in this session is Ms. Outi Kuivasniemi, Deputy Director for International Affairs at the Ministry of Social Affairs and Health here in Finland. And she has worked on EU cooperation on health and social policies, as well as on global health and health security for 25 years. She was instrumental in setting up the whole global health security agenda and the joint external evaluations, GEEs, of health security. She's currently the head of the Finnish negotiation team for the WHO Treaty on Prevention, Preparedness and Response and for the IHR revisions. So with these words, I welcome our first speaker, Stefan Schreck, online, and floor is yours.
Thank you very much, Anna. Ladies and gentlemen, friends, I'm delighted to join you today and have the honor of sharing a few reflections and opening words at this final Joint Action SHARP meeting. From the onset, the aims of this initiative were by no means simple. You set yourself the ambitious goal to strengthen preparedness in the EU against serious cross-border threats to health, and to support the implementation of the 2005 International Health Regulations, the IHR. Working within the framework of two important legal acts, Decision 1082/2013 on serious cross-border threats to health, and the IHR, SHARP was brought to life, building on previous work, such as the Joint Action eMERGE. I also want to recall that the European Court of Auditors played an important role in what would eventually lead to this joint action. The auditors' 2016 report on the implementation of Decision 1082 highlighted, and I quote here, that significant weaknesses at member state and Commission level affect the implementation of the decision and the related EU framework. While the nature and scale of future threats is unknown and may evolve, more needs to be done to address these weaknesses for the Union to take full benefit from the established mechanisms. I believe the Court of Auditors made some very pertinent statements here, particularly in the light of what we know today. Little did anyone know back then and at the kickoff meeting in July 2019 of the avalanche that was about to come with the COVID-19 pandemic and the unprecedented impact it would have in the European Union and internationally. Clearly, the pandemic took a toll on all of us, and SHARP also had to navigate through travel restrictions, public health measures, and new ways of working. From the DG Santé side, we have full understanding for the challenges that were faced by SHARP, with multiple experts being redeployed to help in the national COVID-19 response efforts. However, the road has been bumpy for the Commission as well during the peak of the pandemic. I therefore want to express gratitude on behalf of DG Santé for the work that SHARP has carried out during these difficult times. The meeting of today and tomorrow should be a celebration of the achievements you have made. A special thanks goes out to the Finnish Institute for Health and Welfare for their coordination role and efforts in operationalizing the joint action, as well, of course, as hosting this event today. Ladies and gentlemen, before I close, just a brief word about the future. As you know, the policy landscape at EU and international level has drastically changed since the start of SHARP. The COVID-19 pandemic has led to several developments which have redefined and shaped EU work on preparedness and health policy with the launch of the European Health Union. This includes a new regulation on cross-border health threats that is considerably stronger than Decision 1082, strengthened mandates for the European Medicines Agency and the European Centre for Disease Prevention and Control, and creation of the European Health Emergency Preparedness and Response Authority, called HERA. The EU will continue its efforts in bringing to life the European Health Union. Key milestones are from the side of health security to agree on a preparedness reporting framework by summer and on a revised list of notifiable diseases and a framework to assess preparedness in the countries before the end of the year. Focusing on the international dimension, the Commission launched a new global health strategy last year, outlining priorities and work for the years to come. The strategy brings together several different work strands. One focuses on strengthening global health and health security. In addition, negotiations in Geneva are ongoing to craft a pandemic agreement and amendments to the IHR, with the EU mandated to negotiate on behalf of the EU member states. We count on successful conclusions of the negotiations by the deadline of May 2024. I wish you fruitful discussions and meaningful exchanges over the next 2 days, also taking messages to colleagues outside this room in different sectors and departments. Thank you.
Thank you very much, Stefan, for your kind words. And next we will have a pre-recorded greeting from Dr. Andrea Ammon, the director of the ECDC.
Dear participants, first I would like to thank the Finnish Institute for Health and Welfare as the coordinators of the joint action on strengthened international health regulations and preparedness in the EU, the SHARP joint action, for inviting me to this final conference of the joint action. I regret not being able to attend your meeting in person today, as I will be on my way to Luxembourg for the Health Security Committee meeting. One of the main lessons from the COVID-19 pandemic acknowledges the importance of investing in strong and resilient health systems in order to prevent the spread of infectious diseases and to efficiently respond to health emergencies. The pandemic also made clear that serious threats to health from infectious diseases are inherently cross-border, which underlines the importance of cooperation and coordination with partners, not only at the national level, but also between countries at the EU and global level. The SHARP joint action was established before the pandemic to improve the EU health security framework under Decision 1082 on serious cross-border threats to health, and in fact to close the gaps that were identified already before the emergence of SARS-CoV-2. My hope is that we can draw on the work and collaboration of SHARP and build on the methodologies and mechanisms developed in the different work packages of the joint action, so that we together can strengthen Europe's health security architecture. Based on the early lessons from the pandemic, the European Commission put forward a set of legislative proposals with a new regulation on serious cross-border threats to health, reinforced mandates of the ECDC and the EMA, and the establishment of a Health Emergency Preparedness and Response Authority, HERA. The new legislative framework came into force in December 2022, with all building blocks of the European Health Union in place to prepare and better respond to future health emergencies. ECDC's reinforced mandate, together with the new regulation on serious cross-border health threats, tasks ECDC to further develop and strengthen our commitment to the prevention, preparedness, and control of infectious diseases. Our agency is committed to improving epidemiological surveillance by supporting EU member states in developing secure and interoperable digital platforms for timely surveillance, and by proposing surveillance methods and standards that are valuable to all countries. With more timely, complete, and comparable data within the EU, analysis and concrete proposals on joint public health actions can be taken. Interconnected systems will also facilitate monitoring the impact of health emergencies on healthcare systems in the future. A stronger focus on the human resources component of health systems will need to recognize the dynamic nature of workforce capacity by having in place workforce development strategies that cover the recruitment, retention, and training of healthcare and public health staff. Our agency will coordinate a network of EU reference laboratories for public health and establish a ready-to-be-deployed EU health task force for rapid health interventions in the event of a major outbreak, as well as preparedness support. As part of our support, we will increase training activities and exercises with the member states. ECDC will strengthen and enhance collaborative partnerships at all levels and support building stronger and more resilient public health systems in Europe. It is also within these areas that ECDC experts have been able to provide its support in the different work packages of SHARP, and the outputs of the joint action will be useful to ECDC's work under the extended mandate in the areas of preparedness, IHR capacities, laboratories, and training. Furthermore, one of the 5 strategic objects of the ECDC Strategy 2021 to 2027 is dedicated to increasing health security through international collaboration and strengthened cooperation and coordination between ECDC and partners in non-EU countries. Our extended mandate provides for a reinforced international role for our agency, as well as the EU Global Health Strategy. And we intend to intensify our collaboration with our partners, in particular with the EU neighboring countries, which was also amongst the objectives of the SHARP joint action. And finally, ECDC has increased its capacity in modeling and foresight in order to anticipate different scenarios in the near future and the next few decades that we should be preparing for. We will look at various macro drivers such as urbanizations, climate change, or demographic changes to understand how these individually or combined have an impact on infectious diseases and how we can improve our preparedness plans. During the pandemic, we saw the importance of a multi-sectoral and multidisciplinary preparedness approach with One Health in focus and the need to better analyze the potential drivers of risk. With the new EU health security framework in force and taking into account the work of the SHARP joint action, significant steps have been taken towards a safer, better prepared and more resilient Europe. Even though the SHARP joint action soon comes to an end, the outcomes of the work packages now need to be reviewed and translated into health policies and actions at all levels, regional, national, European, and even globally. ECDC looks forward to continuing collaborating closely with the partners that have been part of the joint action, as well as with international organizations such as WHO, so that we can strengthen together our preparedness and response planning and the resilience and response capacities of our health systems. The framework and building blocks are now in place, and we all know what needs to be done. We don't know when the next emergency will strike. So, let's pull up our sleeves and set to work. I wish you a fruitful event and look forward to implementing the outcome of your efforts together with you.
So virtual thanks to Andrea Ammon, and maybe to ECDC. We have representatives here as well. So warm thanks to ECDC for supporting our joint action throughout the whole period of time. Next, and not last but not the least, we have Outi Kuimasniemi from the Ministry of Social Affairs and Health, Finland, and she will be giving her words of welcome.
Hope you can see me behind the flowers here and hear me. Fellow proponents of health security, I'm honored to represent the Finnish Ministry of Social Affairs and Health at the final conference of the SHARP Joint Action. The Joint Action is a significant investment in health security capacity building on the regional level. The collaboration between institutions and experts has come at an important time. The world has undergone a severe pandemic, an event at a level we have seen last a century ago. Despite repeated warnings from experts on the need to strengthen national and global preparedness for health emergencies, the world was not ready to deal with the fast-spreading severe novel pathogen. In the face of uncertainty, decision-making on the right countermeasures was difficult. The situation was also exacerbated with deliberate misinformation and disinformation campaigns. Understandably, the pandemic also had an impact on the joint action and made the management of the project challenging, and an extension was granted. Despite all this, the joint action is successfully concluding its work. We look forward to the outcomes and recommendations of the joint action. Over the past years, the EU has made significant improvements on its legislation on the European Health Union, as mentioned by the Commission, the revisions of the legislation on cross-border health threats and the mandates of the ECDC and EMA, as well as the establishment of HERA, are designed to increase regional readiness and response capability. These are supported by new strategies and legislation on pharmaceuticals and the European Health Data Space, as well as on strategic autonomy and global health. At the global level, we are currently negotiating a new treaty on pandemic prevention, preparedness and response, and the revision of the international health regulations. We hope that the contacts between experts that have been reinforced through the joint action will be useful in finding solutions based on shared experiences and models in these difficult negotiations, as well as in the implementation phase. The EU bears a global responsibility for health security, and it has taken an active role in the redesign of the global health and health security architecture. For example, by supporting the establishment of a new financial instrument for preparedness at the World Bank. The regional collaboration is important, especially within the wider Europe and with Africa. The establishment of the African Medicines Agency creates new opportunities, building on the work already done with the African Centre for Disease Control. We hope that this collaboration builds on exchange of experiences both at national and regional levels. Health security and preparedness are long-standing priorities for Finland. The full implementation of the international health regulations has been important to us, and we have been engaged in global collaboration to assist all countries to improve their preparedness. Finland joined the global health security agenda from the very beginning, and during our chairmanship in 2015, the joint external evaluation process was developed and piloted in 6 countries. In 2016, WHO adopted the JEE as a tool with the aim of helping countries prepare their national action plans for health security. 124 JEE missions have been completed to this date in 120 countries. Many Finnish experts have taken part in these evaluations and in workshops designing new versions of the tool. From this point of view, it was natural that the THL took the lead in the EU joint action that focuses on strengthening preparedness in the EU against serious cross-border health threats to health and to support the implementation of IHR. Finland has taken a comprehensive approach to health security and the collaboration between different sectors is an important element. This includes One Health collaboration as well as civil-military collaboration. The security of supply is another essential element of our preparedness. A good example of cross-sectoral collaborations is Finland's participation in EU's civil protection mechanism through a project that will establish and maintain a rescEU CBRN stockpile. It will contain chemical, biological, radiological and nuclear protective equipment, measurement equipment, support equipment, as well as medicines and antidotes. Finland is coordinating the project under the direction of the Ministry of Interior and in collaboration with the Ministry of Social Affairs and Health, the Finnish Institute for Health and Welfare, the National Emergency Supply Agency, and the Radiation and Nuclear Safety Authority. Health security is included in the Security Strategy for Society, taking a whole of government and whole of society approach. The new government programme published on Friday forces a revision of this strategy. I believe that taking into account the lessons learned from the past years, the recommendations from the sharp joint action will be useful in this regard. While the pandemic put health security in the headlines for 3 years, it is important that we evaluate its impact and implement the lessons learned before they are forgotten and surpassed by other emergencies and political crises. The risk of occurrence of severe cross-border health threats or a pandemic remains high as the humanity continues to push the limits of the planet and the climate. We need to break the vicious cycle of panic and neglect and make the necessary investments in national, regional and global preparedness. Maintaining relevance in the age of permacrisis is a challenge. Nevertheless, the global interest in health security capacity building has had a positive impact, making the investment case in capacity building has become easier as there is an understanding of the potential impact of health emergencies on the society, economy, politics and wider security. The percentage of countries reporting on the IHR implementation has risen from merely a half to 94% over the past 10 years. We hope that the collaboration between the institutions participating in the sharp joint action has created permanent avenues for both formal and informal exchange of information, experiences and views, as well as scientific collaboration that is conducive to a safer Europe. On behalf of the Ministry of Social Affairs and Health, I would like to convey to you our highest appreciation for your engagement. Congratulations and thank you.